Hello, everybody, and good morning. My name is Ricardo Cabrera. I'm the operations manager here at the Latino Chamber of Commerce of Boulder County. And today we have our very special guest back, Dr. Liz Mendoza. She is with Boulder County Public Health, and we are going to talk about vaccines. We're going to talk about COVID stats, and we're going to talk about the great news that there is now a vaccine for the little ones, ages 5 to 11, and we're going to get an update on all of those things and more. So Liz, welcome. Good morning.
Oh, hi, Ricardo. Good morning. Hello, everyone. Very nice to be here.
Excellent. So let's start with COVID stats. What has changed since last week to today? Liz, take it away.
Yes, well, things have been changing, and this means we have great challenges ahead of us. And this also considering that we're coming into the cold months, right? Where we get other kind of bugs coming in, including the flu. So yes, what we saw is just like in the rest of the state, our county also experienced an increase in cases, a good increase in cases. One thing that we want to kind of like take a little time to discuss is the cases of those areas that are kind of like in the edges, like in the frontiers of our county, that are touching other counties where cases are really, really dramatically increased. So for instance, we have Longmont, and we know that we saw the most of the cases in our county in Longmont. The highest percentage of cases were there. And it happens to be that Longmont, as you know, is next to Weld. Now, Weld has had the highest accumulated rate in 7 days of all. And the increase that we saw and that's the highest, but also the increase that we saw was quite important. Even when that, on top of that, it was about 12% just in Weld. But then we look at the case of Netherlands, and Netherlands is next to Gilpen. And the thing with what we observed in Netherlands was that there were a lot of outbreaks, there were some outbreaks, but there were also school exposures, multiple of them, which we haven't seen before. This situation is a kind of like a bad situation. And then if you look at Gilpin, then you see that they have an increase of 37.5% in their cases in the accumulated rate. That was a very important increase. So that's what we see, how is that impacting us, our county, what's happening in other counties, in our neighbors. And so that's what we see in the numbers. But then what we see, like actually physically happening, we can actually see it evident, is that the efficacy of our measurements in public health is really going down, and that comes in hand with the lack of compliance with the orders of health, public health. So we see that people are not using their face coverings, they're not using their masks, and we see that in even if our county, when we have an order to do that, but also we see in other counties that they don't have orders in place of that size. So altogether, the fact that this is happening, now we're seeing the results of that. Now, if we go back to look at our indicators, okay, we always talk about the accumulated cases, the average rolling counts, and so on. Those two increased, okay, the last week. And what this means to us, and they were good increases, and what this means to us is that we are still in a red state of high transmissibility in our county. What does that mean? I mean, not only that we're having great transmissibility, but that means that we really need to use our masks because of that, because increased transmissibility. Don't forget that we still have Delta. Delta hasn't left. And the same we're seeing in the neighboring counties. Now, all of the cases, all of the age groups, they all saw the increase. But the greatest increase we saw it in people between 23 and 44 years. Okay, so these are young adults, people who are working, they should be productive and so on, but they got sick. And then as mentioned before, about 41% of the new cases that we saw in our county was in Longmont, which is an issue because Longmont only has a 29.5% of our population. So it is not proportionate. When we look by race and ethnicity, we also see that, well, I mean, 72% of the cases were among the white, non-Hispanic population. Nevertheless, we saw in the Hispanic population around the 23% of the cases, which is significant because we represent only the 14% of the population. So that's, again, not proportionate. So if you have friends in that population, please help them get a vaccine and to use their masking as well. And you use them with them because, you know, they're the ones who are in trouble. And then just in overall, hospitalizations, pediatric cases, and mortality, they all increased as well. So yeah, this is very challenging, and we really need to kind of like catch up with the public health orders and get vaccinated to be protected.
Wow, that's terrible. Yeah, so it sounds like, you know, I mean, we're still in a high transmissibility state according to the CDC, so we are on red. And, you know, what's interesting about what's happening the last week is, you know, obviously that all the cases went up on all age groups, and, you know, hospitalizations, deceased, all the stats went up. But the new variable that we haven't heard before is the fact that COVID doesn't have any borders. So it would make sense that, you know, in counties where there is no mask order, you know, like Weld next to Longmont, you know, there's travel. People go and work to Weld County, and Weld County people come and work to Boulder County, and the masking ordinances are different. So transmission elevates itself. So the same with Gilpin. I can't believe 40. What was the number? There was an increase of
about 30.
Yes, 37% increase in 1 week. That's crazy. So let's invite everybody again to use the tools at hand that we have, which is, you know, use your mask, social distancing, and get vaccinated when you can. Even if you're going to other counties where masking is not required, you know, I'll invite you to use it because, you know, we can prevent the slide that we're having and the uptick that we're having on cases. You know, this is pretty dramatic because I think it's the worst that we've seen in quite a while. So let's keep that in mind and help ourselves and help our neighbors by using masks. All right, Dr. Liz Mendoza, tell us about vaccination. What have we learned since last week about vaccinations?
Well, vaccination is kind of like the sunshine. It feels better because, so just the last week, 1,900 people got their first dose. We're in a good path there.
Yay.
I mean, that was, thank you very much. And with that, until the 28th of October, because that's where the counting stopped, for this report, I mean, about 79% of the eligible population and near to 70% of the total population of the county had received a complete cycle. That is awesome. This is great. And then when we look at the ones that have received at least one dose, it's still pretty good. About 85% of the population who are eligible and 75% of the total population at least have one dose. So we're in a good path there. If we look, but still, that doesn't mean that, oh yeah, now we can get distracted and do other things. No, we need to really push those numbers, but we're doing great. Now, in terms of the age, we saw, increase. I mean, we're doing really good. The kiddos between 12 and 14 are really doing great. They are in, at least they have received a full course in about 74.1% of this population, 12 to 14, that they're leading the race among the kiddos. And then, well, the kids like older kids, teenagers, 15 to 19, they are in the 59.2, and then we have the young adults, 20 to 29, that are in this near 62%. And then from there, numbers go up really fast, over 82%, up to 98% in the people 70 and plus. Mm-hmm. So we're doing good. If we look at numbers, in absolute numbers, we are talking about 228,500 people who have received the complete course. But still, we have 43,500 who are eligible but haven't received the vaccine. So don't miss your opportunity and help us push these numbers so that we can, stop the spread of Delta. Or at least, we kind of like slow the spread of highly contagious variants. Now, the other great news here is that finally, kids between 5 and 11 will be able to be vaccinated. This is awesome. The parents have been waiting for this moment. A lot of parents have been waiting for this moment. A lot of parents are still having some questioning and doubts and everything, and we invite them to call us. But the thing is that it happened now. So that's the official news that is already approved. When are they gonna start being distributed here? We believe by the 5th of November. So not today, but we're thinking that around the 5th, the first few providers are going to start doing that, and appointments are starting to be done. So call your provider and see if they can get you an appointment. And then from there, little by little, all along the next week, we hope that more and more providers will be able to give the vaccine. Why is this going to take long? Why not so much offer when there is so much demand? So one of the factors is this is a different vial. It's the same vaccine, it's just different dosage, different concentration. Therefore, it's a different presentation. Manufacturing is separated from the others that we have for adults. So then, of course, that is taking time to be distributed in the country and distributed to us. One thing. Second, as you may recall when you were kiddos, and those who are parents know, vaccination in kids is not as fast as vaccination in adults. So mostly in this group of age. So that makes it that it's going to take longer to take appointments and to give them actually the vaccine. So yeah, it may take a little longer than you you might be expecting, but it is going to happen. There's going to be vaccine for all the kids. It's just going to be slower, so be patient. But for sure, 3 messages here, important things, is call your provider first thing. Whoever you have, Kaiser, Salud, Clinica, whoever your provider is, your pediatrician, and ask if they're already giving appointments. If they do, take the first appointment that you can. Second, if they say, no, we are not, well, when are you gonna do that? Tell me, and then take a note of it. But I recommend you go and start asking in the pharmacies, supermarkets, and so on, if they have already taken appointments for kiddos. And if not, if any of that goes wrong, visit our website, in our page for these providers of COVID vaccine. You will find links to clinics that will be advised there. You'll see these are taking pediatric appointments, and try to get an appointment in there. They will be popping up little by little as they come. But we also know that they're going to be filling up fast. Don't give up, even when they apparently are filled up. Some people cancel, so go back and visit and see if they open a space and take that appointment. So that's the other thing, try to get your appointment like yeah. And the other thing is mask up. Please follow the public health orders. They are there for a reason, and we are seeing the consequences of not following them. The vaccine is extremely effective, also in the kids, but there is nothing, the vaccine will not stop the spreading of the virus to those who are not vaccinated. And the most of the cases that are really severe and deaths go to those not vaccinated. So having said that, wear your mask is for your own convenience, it's for your own good. Wear your mask, and so help us to stop this spreading Delta and these variants.
Excellent, Liz. Thank you for sharing. Great information. It sounds like vaccination rates are going up, which is what we want. I mean, we've been at around the same place for a couple of weeks where 43,000 plus eligible people have not been vaccinated. The biggest, news that we have is that kids now can be vaccinated. There is a vaccine that is approved, and there's 23,500 kids in our county that are eligible now for this. So guys, there's going to be a rollout period. I would say be patient, make an appointment now if you can, so you can get in line. And if your provider doesn't do it now, do it next week. It's important that we get even our kids now vaccinated is the biggest age group that is not vaccinated. I mean, actually at 0%. So it's all going to be good for the county and for the community. Be patient with this rollout. It's, we've been through it before, so it's going to be slow at first, and then it's going to be fast after that. So, and then our last message that Dr. Liz is sharing with us is use your mask. It's really the only and most effective tool we have still today to prevent this. Now, this cross county exposure seems to be the new important thing. And, if we go to Guilford County, if we go to Weld County, they don't have a mask mandate. So it's really easy for us to show up over there and forget about the mask and then, get exposed and come back and share that, which is not good. So remember, wear your mask, social distancing, get vaccinated, and disinfect. So with that, I think we've covered a lot of material today. Thank you, Liz. Is there anything else you'd like to remind us of today?
Yeah, just like always, if you have still questions about vaccinating your kid, vaccinating yourself, anything, no question is stupid. Please call us to our call center. The staff is well prepared to answer your questions, and if they can't, they will contact all the specialists to get you an answer. So please do so. We're eager to help you make that decision.
Thank you, Liz, for everything. Again, as usual, you're great. We'll look forward to seeing you in the next 2 weeks. And with that, thank you, everybody. Have a great weekend. And until next time.